Welcome everyone to today's presentation on the substance use disorder. Let us begin with the little bit of introduction about the topic that we are going to discuss today. So, what is substance use disorder? So, basically, it is a complex and often misunderstood condition that deeply impact the individuals, families, and the communities worldwide. So, substance use disorder, often you have heard about the term addiction. So, basically, we like a layman, in the layman language, we call it the addiction. So, substance use disorder is actually a problem, a medical condition, a chronic medical condition that is characterized by compulsive drug seeking, continued use despite harmful consequences, and a loss of control over one's substance use. So basically, as we also have seen throughout the history, the substance use has been a part of our human culture, ranging from the traditional rituals to the recreational activities. However, when substance use escalates to the point of causing significant impairment in the daily functioning and the quality of life, it transitions into the substance abuse disorder, and it can affect the anyone, any age, any gender, any socioeconomic status or the background. And understanding substance use, substance abuse disorder needs a non-judgmental approach, because there is a lot of stigma that goes around the substance use. Like you have heard about, you may have heard about the topics that um, people often think that people who use drugs are the bad people, or it's their choices. Not, it's not about it's not the disease. People often think that addiction is not a disease, but rather it's a choice. And some people even think that people who are addicted needs to be punished because they are ruining the society. But actually, it's not their choice. So what goes here, we will delve deeper into as we go further into the presentation. But as for now, we can I can tell you that when a person starts using the substance, any kind of substance, any kind of drug, any kind of alcohol, so there is a lot of things goes on the person's brain. It affects the person's brain, the neurological the neurological changes that occur in the brain. So that's why it goes difficult for a person to stop. So it requires help, a professional help. So in this presentation, we will delve deeper into the various aspects of the substance use disorder, including its various causes, and by fostering a deeper understanding, I hope substance by fostering a deeper understanding of the substance use disorder, I hope we can work towards the building more compassionate and effective responses to this pervasive health challenge. Thank you everyone. Once again, thank you everyone for joining us today as we embark on this journey of exploration and of the addiction. So let us start with the presentation now. Um, we will so let us discuss what we'll be going to learn in this presentation. So we will be able to understand what is substance abuse, factor that's called the substance abuse, um, like what causes the substance abuse disorder, and what the different stages of the substance abuse disorder, how can we help people with their addiction if someone close to us is suffering from the addiction. So what can we do to help him or her? um, like um, like even just saying that we are here to help you, and you are not alone. So but these are the things that we can do for a person who is suffering from the addiction. And some of the government, I have also listed some of the government rehab center for the drug addiction, that is totally, I guess, totally free of cost. I guess government pay for that. And here are some famous personalities who struggle with the substance use disorder. As I listed them because there is lot of stigmas around this topic. So I thought, why not um, indulge into the some inspiring stories. So Robert Downey Jr. So he struggled with the heroin, alcohol, and the cocaine. Often, you most of the people maybe known him as the Iron Man. So he even stated in one interview that stopping was not hard, but trying to not start again was the hard thing. So Robert Downey Jr. was an excellent and very inspiring personality who goes through a lot, but he just come up with every struggle he has faced. And also Sigmund Freud, yes, Sigmund Freud also struggled with the cocaine. He started it to experiment. He started to experiment to deal with his negative feeling, and the um, to experiment. He just started to see what goes around the cocaine and what will happen if he take this. Will it be helpful in his negative feeling? And he seek the treatment after one of his patients died due to the overdose. I guess it was in 1899. And third one is the Ranbir Kapoor. He tried drugs in his college days, like usually the adolescents and the young adults do, for in the name of the experimentation. And now he's addicted to nicotine. He stated it in one of his interview. And by the way, nicotine is more dangerous than the other than the other substances. And the fourth one is Sanjay Dutt. We mm, uh, I guess he got really viral about his journey. He even stayed in the rehab for 2 years. He was very open about his journey on the substance abuse. And then there is Manisha Koirala, because there is a lot of stigma that women don't drink, and what and even if some and even if a woman is suffering from the substance abuse, the families do not seek the help to come forward, because it often think that, oh god, what will happen mm, to our family reputation. So yeah, Manish Koirala is also a very um, big inspiring story, um, who struggled with the drug addiction. So basically she started using the alcohol and the drugs as a coping mechanism. um, she stated that to relieve her pain, she started taking the alcohol, to think that alcohol is a solution, but it is not. Then there is Javed Akhtar. He is also a famous personality. He also was addicted to the alcohol, but seek the treatment later in his life. Then once again, what is substance abuse disorder? So substance abuse disorder is a complex disorder where a person is unable to control the intake of the illegal drugs and alcohol, which affect the person's brain and the behavior. So what happens when the person start taking the alcohol or any types of drug? So there is a release of the dopamine happy hormones when a person takes the drug or any alcohol. So what kind of dopamine? And okay, so dopamine is a happy hormone. So when a person takes any type of drug and the alcohol, the person feels the high amount of happiness. So to experience that again and again and again, the person start taking the alcohol or the drug by more often, and that's how a person develops a substance abuse disorder. So causes of the substance abuse, what causes a person to have a substance abuse? So there is a lot of combination of factors that can contribute to the risk of developing a substance abuse disorder. It includes the environmental factors, like if a child or if a person is coming from the background where the alcohol or the using of drugs was normalized, like in the Manisha Koirala talked about in a interview that his father used to drink alcohol, and taking alcohol was drinking alcohol was totally normalized in her family. So she started taking it and nobody questioned her. So a person who is coming from the background where the alcohol or any type of substance is normalized, then they are on the high there are the high chances that the person will start developing the substance uses, and that will convert into the substance abuse disorder. So the second point is social pressure. There is also a social pressure, like uh, um, for example, if adolescent is sitting in his friends group or any type of peer groups, and all of their peers are vaping or smoking or any kind, or just taking any type of alcohol or consuming any type of drugs, then and if a person declines their offer, they often is seen as a uncool person, or what do you say, old thought person. And often often the child or the adolescent or the young adult start using it for the fear of being left out. So he or she maybe feel that they are being left out for the fun from the fun, so they start using it under the peer pressure. That's the peer pressure. Then there is the genetic vulnerability. um and the genetic vulnerability is like, if like for example, if a mother, like if a person's so in the genetic vulnerabilities, if a child mother has taken any kind of drug or any kind of alcohol during her pregnancy, there is a high chance that the child was born a drug addict or the alcohol addict. So yeah, genetic also plays a very big role, big role in the substance abuse. And there is the individual personality characteristics. So individual personality characteristics, how does this factor affect the person's risk of developing a substance abuse? So if a person is like how do I say it, if a person is kind of a very comes from a very depressed personality, then a very introverted thing, so he or she might develop um, the risk of substance abuse. And there is the last one but not the least, the mental health condition. Often the persons that has like the substance abuse disorder often coexists with the other mental conditions. For example, if a person is depressed, then there is a higher chances that he or she will turn to the alcohol and to relieve his her pain. So yeah, mental health conditions like depression, PTSD, anxiety also affect the substance abuse. And there is the stages of substance abuse. So what um, substance abuse often progress in the stages, like it's not like that the person just starts having any kind of substance or any kind of drugs or any kind of alcohol. It starts somewhere. So where does it start? It starts usually in the name of the experiment that the person usually have due to the peer pressure or with the fear of being left out. Then after the experimentation stage comes the regular use. Often the person who starts experimenting due to the peer pressure, now the person is using the substance more gradually and starts developing the tolerance. um, this happens because of the this also happens because of the peer pressure or the fear of being left out, or maybe the person is started enjoying the substance. Then the third stage comes the dependence. Now the person's body has adapted the substance. Now it will be easier for the person to just take it, just to consume the substance. And the fourth one now becomes the problematic use. It starts when the person starts prioritizing it over daily work, and the he or she might have started seeing the consequences that they are having due to the substance, by due to taking the substance, or due to what they are consuming. And now comes the addiction, the fifth and the final stage. So even even in the problematic use, if the person sees the earlier signs and starts thinking that no, this is now causing the problem and I have to stop, but and still if the person did not stop, then the last stage comes the addiction, and now the person has fully lost the control of stopping themselves, because the activities that goes on the brain has now become the addict of the using substance. Then the ways to help a person with the substance use disorder. So beside of the professional help, what we can do is educate and aware ourselves about this disorder. Like mm, we have often heard about the thing that addiction is a crime, or addiction is not a choice, but addiction is a choice, not a disorder. And we have often think that people who got an addiction needs to be punished, or we have heard that um, they are addicted because of their choices, they do not have any willpower. But that's not the case. When you educate yourself and aware yourself, you will get to know that it is not the case. The person has tried and now it is now it is not in their control, it is out of the control. And now the building empathy. So second one is building empathy. So what is empathy is when you start listening to the person, or start empathizing them. So what happens when you start empathizing the person? They get to know that okay, there are someone often there is someone who can help me, and and the people and the person knows that okay, if there is problem, I can reach out to the person and they will help me. Then the third one is the coping skills development. So basically most of the time the people start the person start the using of the alcohol or any kind of drug because as a coping skill management, as a coping skill, because to relieve some pain or to escape the reality. So by building the healthy and the happy coping skills can also help the person in the substance use, like meditation or painting or any kind of any new hobby that help the person in whatever they are feeling. Then there are some movies that talk about the substance use to getting aware about them. So there is Charles, Ram, Hare Krishna, Janbaz, Jalwa, Fashion, Devdi, Shaitan, Pankh. So these are some movies you can see after this presentation to get more aware about the substance abuse. And there is this government rehab center for drug de-addiction, like there is Institute of Medical Sciences Trust Mulana, डिस्ट्रिक्ट अम्बाला में है ये उम्मीद फाउंडेशन, गुरु कृपा फाउंडेशन, तुलसी हेल्थ केयर रामगढ़ and Bhagat Phool Singh. So yeah, these are the government rehab center for the drug re-addiction. And thank you for having me, and here I raise my topic. I hope you will be now more aware about the substance abuse disorder. Thank you very much.